can you walk us through a case where treating the jaw actually relieved a full body symptom?
Well, in every patient, we remove these cavitations. They have a huge relief from their energetic systems, and the tensions are gone, pains are gone, joint pains are gone, because it's always been there, and they couldn't have imagined how it would feel like as they haven't lived it, as they haven't gone through it. It is tiring. It is exhausting to have like this surgery done, but it's so rewarding, you know. And that's basically it's the best effect.
Right.
That
Is it
that can
quite a difficult procedure?
It's not really difficult. So if there's only the cavitations to be done, let's say, okay, we've got 28 perfectly healthy teeth,
Right.
and 4 cavitations in the rear, you can say it's about 2.5 to 3 hours procedure. It's overseeable, and 3 days of downtime.
So you need to take 3 days out.
Yes, most definitely. Most definitely.
Okay, and the recovery, is that fast?
Yes, it depends. It depends when you're moved, when you're used to this fast moving pace, you know, to this stressful and buzzy life. You won't fit into there anymore, because
Right.
your system calms down a bit. You get centered a bit more. You get grounded, and that's basically what most people need, you know.
Wow, so you're actually saying that by removing the cavities, you can actually de-stress the whole nervous system.
For sure. And also, if you only regard the neural surrounding, we are on the literally in the area of the trigeminal nerve and of this where it splits up, you know. And if we have irritations in that area, it will affect this whole brain nerve, yeah.
Absolutely.
And this whole cranial nerve.
Okay.
And it gives a huge relief.
So this is where we see that when people have a large form of tension from the actual bruxism, we have this extreme tension in the sternocleidomastoid, and this then takes the whole section and goes into your trapezius.
Yes.
So people have this constant trapezius pain, and little do they actually know that it actually comes from the effect of the TMJ area.
As said, neurotherapy will open their eyes, because they use it. There's no tension anymore.
There you go. Absolutely.
Yeah.
So the one links to the other.
One simple injection, yes, could be so easy.
Unbelievable. Okay, that was really interesting.
Yeah.
Can we go on something slightly different? I would like you to integrate now something to do with the interference field and the energetic blockages of the system. A lot of people have no clue about this and how it affects the dentistry department with the actual immune and, let's say, the health being of a patient.
Yeah.
So can you give us an explanation on that?
So given that our body is equipped with these energy meridians, where we have the energy circulating, it's quite clear that if there's any interference in this energy flow, there must be some problems in certain regions of the body. That's basically how the Chinese explain how any ailings or illness evolves. It's we have this energetic imbalance, or an overload of too much energy. For example, like a headache, all your energy is in your brain, and you get these migraines or anything, and you just need to release it. bioacupuncture, for example.
Correct.
Or if your energy is low, you have these cold feet, or you have
Lack of circulation.
yes, a lack of circulation, and that's why scars can be, for example, an interference field, because they block the flow of energy.
Absolutely.
And as soon as the scar is deblocked, what we can do, either by using procaine on the scar or by ear acupuncture, the proper flow of energy is being restored, and the ailing in this particular region should subside.
Is that a temporary effect on the
The
scarring?
deblocking of the scars is permanent.
Oh, it is permanent?
Deblocking of scars is permanent. When it comes to dental interference fields, so if we have, for example, root canal teeth that are on this particular meridian, and let's say the patient is suffering from some joint pain on the knee or in the feet or anywhere, we can't just deblock it, because it's an active inflammative process. So if we do neurotherapy, it'll last about 10 to 12 hours, and then it'll come back, because it's not just like a scar, which is like reset, but we need to get rid of the interference field itself. So in terms of root canal teeth, we need to take the tooth out, and if needed, put a ceramic implant there. If it's decapitation, okay, we need to clean it out, and that's it. So the interference field is gone, and the flow of energy is no longer disturbed. So that's the first two types, like scars, dental interference fields, and which is absolutely underestimated also in fellow physicians or doctors or anything, is these emotional interference fields. So we're talking about decades of anger or unhappy marriage, or what else can there be? Grief.
Or shock.
Like in the sense of an emotional trauma, which
trauma.
people carry around them. This has massive effects, because it just sucks up the energy,
Right.
which then is not available for healing or for other self-healing processes within the body. Our body is fully capable of healing itself, but it needs the energy.
That's correct.
And I mean, you see this with all your patients, most probably.
Absolutely. So you would say that every single tooth is connected to a certain meridian. So if you remove that tooth, what would the effect be on that meridian?
Well, depending whether if that tooth, are you talking about a healthy tooth or
No, let's say
an interfering tooth?
interference.
It's well, then the natural flow of energy is being restored, because the interference field is gone. So we can additionally by if we use the tonifying point of the meridian, we can additionally raise the energy level of that particularly meridian after getting rid of the interference field. So it's always to be regarded from the energetic level, which is quite hard to understand.
Of course, if people
Because
understand that.
people cannot imagine, like, well, there is nothing. Why is there a meridian? I mean, there's a nerve. Okay, I can see this nerve. I can see this vein. But it's pretty hard to understand, right?
Yeah, if you don't know the connectivity between
Yes.
the meridian and the actual tooth, then of course you would get confused. So women that have cesareans and they have a very large scar, what effect would that have?
It has well, scar interference fields always have various effects, so you can't really tell this will result in that and that and that. But if we scan, for example, the ear area of this cesarean, it's always interference fields because it's not only one meridian, it's 5 meridians being affected,
That's
at least,
correct.
depending on the size, and it goes deep. So in this case, ear acupuncture has proven to be the best method of deblocking, because you would need huge doses of procaine. You would need long needles, and you wouldn't know where to go because there's no visibility.
How deep the scarring is.
Exactly. It's not a superficial scar which you can easily deblock by injecting procaine. So
you use in microscopic ear acupuncture needles?
not really microscopic. I'm using the laser.
Oh, just laser?
Just the laser.
So you wouldn't be using needles applying in specific point areas and leaving the needle in the ear?
You can do that. Well, I use resorbable needle implants. So it's a carbohydrate needle that dissolves within 3 to 6 months.
Right.
But the scar deblocking we do either by an impulse laser, so like a laser shot, or the frequency laser with a specific scar deblocking frequency.
That's amazing.
It is. And with big areas, what has also worked quite well is like procaine injections in the area, like putting little quaddles.
Well, that's fantastic.
Yeah.
Right.
That works quite well.
So would that procaine be an alternative to using Botox?
I've never been thinking about that, to be honest.
It was just the thought that came into me, because a lot of people use Botox for bruxism.
Yeah.
And
do they actually?
They do.
I've never heard that.
Absolutely. And
can they properly chew?
Oh, well, we have this problem. Yeah. We do have this, and also to get rid of their migraines. But of course, this is I believe it's quite toxic to the body.
It is.
We need to find an alternative in this situation.
Most definitely. Most definitely.
Okay, so let's talk about the EMFs and what impact they have on our system. And how would you relate electromagnetic fields affecting the dental treatments and the systemic healing?
Well, the thing is, most EMFs, so we're talking about Wi-Fi's and cell phone frequencies, they will keep you in a sympathetic state, which basically says it all, because proper healing and also detoxifying can only take place in parasympathetic states. We all know that when we're getting a little bit of a sore throat, we realize this in the morning when we wake up, when we've just had our recovery phase. Okay, I got a little bit of sore throat, and then when we kept going, after an hour or two, it's gone. During the day, it's gone, and it'll come back in the evening. It's like our body's signaling us, okay, let's go to sleep, to parasympathetic state. But if we're kept in this sympathetic state all the time by these Wi-Fi surrounding us, they don't really allow us to go in deep relaxation. And also proper wound healing cannot take place in this state. So it's so important to have these little devices, to keep this electrosmog off us.
So it's definitely recommended to ground the area.
Always.
And make sure that at night you don't sleep with any form of electromagnetic fields in the bedroom. Okay, that is very important.
Most definitely.
We also found that by sleeping with cell phones, let's say your iPads or smart TVs, over the years, I can say that as the G gets higher, like 4, 5, 6 Gs, we found that it actually depletes vitamin D.
Okay.
Because we started to see a depletion of vitamin D in Cyprus in 2017.
Okay.
And we living in a country that has got sun. So
plenty of it.
Absolutely. So once we biologically tested the vitamin Ds, we had this drop in absorption of vitamin D. And we would testing thousands of patients. And what we found in patients that are high in toxic EMFs had very low vitamin D. So by stop sleeping in a room with your phone, your TV, and even charging your phone, once given vitamin D, we started to see the vitamin D rising. But as soon as it comes into the electrical formation, we see the D dropping again. And we've been testing since 2017 this, and unfortunately, we do find that it has an effect in the absorption rate.
Okay.
So we recommend to all our patients not to sleep with their phones in their rooms.
Most definitely. And also in these electrically driven cars, it's the DMFs, they're beyond anything.
They're so nice to drive and so quiet.
Yeah, they're so quiet. They don't harm.
Yeah.
But you can't see it, you can't feel it unless you're really electrosensitive.
Absolutely.
And it's like that's radiation. You can't feel it really.
Absolutely. And again, I would recommend a person who has got an electric car to put an EMF blocker in their car.
Yes,
so that at least they can ground them and it doesn't cause any high fields of electromagnetic static toxication.
Yeah.
Oh dear. So, can EMF sensitivity interfere with detoxification, wound healing, or the nervous system?
Yes, as said, most definitely, as it keeps you in this sympathetic state and doesn't allow you to calm down. Wound healing is very badly affected. So I'm always recommending my patients to have these devices like the Beaver Base or whatever they're called, to have them with them, especially after surgery, and not to spend screen time on their phone unless it's chipped, and in general, get off these electronic devices, all the Wi-Fi devices in the healing phase.
In the healing phase, and not to put their phone directly onto their ears.
No,
that's
always
very, very important.
Always either connect physically with a cable, or you say no. No. Or use the microphone from a distance.
We found the microphones to be less toxic. Even the cables themselves, they cause high electromagnetic fields. They cause a problem with your gamma, your alpha, and your delta wave.
Okay.
So this will cause problems with your memory, your cognitions. It causes dehydration of the myelin sheaths in the brain.
Mm-hmm.
So these are highly dangerous, especially if you're using the pods, as you were speaking to me.
The pods are still different. Yeah, they're still worse. But is it actually better to use like this cable microphone than putting the phone itself to the head?
Oh yes, if you need to, absolutely.
So it's already better, but best thing would be like to have it like a meter away and then just talk like that.
Well, even by holding the phone, it's causing electrical charge fields, and this is blocking your meridians. We've seen that. It does cause harm. It depletes the energy straight away. It can block the meridian. And again, you're in a different mode. You're starting to have fatigueness, tiredness, brain dysfunctional. So I believe that if you're wanting to use your phone, better that it's placed on the table and you're speaking through that without having to actually come into contact with your phone if you really want to go a different way and stop interfering with the energy fields of your body.
Yeah, that's right.
Definitely we would recommend patients to put like a reso shield behind the phone so that they can reduce the level of electromagnetic fields, and they're safer, as well as on their iPads. And obviously when you're sleeping in a room in the evenings, I would not recommend to have anything switched on, because it's a healing process, like you said.
Yes, we need this parasympathetic state.
Yes. The other, we found swimming in the sea to be a negator to electromagnetic fields. So we did quite a lot of measurements on patients who were full of electromagnetic fields. And then we found patients that had no electromagnetic fields or electrical charge. And we found that all those patients were yearly swimmers. So
That's amazing.
they had a very low form of toxication, which was brilliant. So this is called grounding, basically. So the best thing to ground is in the sea. Take your shoes off, go stand in a field of grass or in let's say, the forest, but do the same in your house. Put yourself a shield that will protect you from these electromagnetic fields. I mean, do you agree with that?
Yes, 100%.
Okay.
100%. I've never been thinking about the grounding effect of swimming, but it's logic, right? It's water.
Absolutely. It's the best grounding treatment you can give.
Great.
To cut that field of
That's fantastic.
electromagnetic toxication.
Yeah.
Okay. Can we go now on to a subject that I believe is important for everybody when it comes to dental oral hygiene? Can you speak to us about the good value of nutrition and functional healing properties that are necessary?
For sure. I mean, as said, I recommend an anti-inflammatory diet to every patient I give surgery to, in order to prepare them to have the best possible bone healing there is. So it's not only the anti-inflammatory diet, like cutting those bad short-chained carbs and sugars, but also refrain from meat, as well as any processed foods or like these convenience foods, as they're called, and on top supplementing the basic vitamins and trace minerals that we need for bone healing, such as vitamin C, CoQ10, magnesium, selenium, which is really important as an antidote for mercury, right? We know that.
Yes.
And as long as the patients are not vegan, they should also take bone broth on a daily basis.
That's so important.
That was basically one thing I wanted to ask you. What do you offer as an alternative to bone broth for vegetarians?
We use silica, which helps also to create, let's say, the correct amount of synovial fluids intake. It's also a good mineral which strengthens the bone structure. We would definitely use something like magnesium phosphoricum. So we'd go homeopathically. And we would use, let's say, broth from vegetables. Okay, but we would go with vegetables that are high in calcium, high in magnesium, potassium, zinc. We would put a cocktail for them together.
I see.
We would recommend a collagen. We've tried the vegan collagen, but it's not as effective. We've tried the fish collagen, and yet again, we do seem to have a depletion in bone mass. So after seeing thousands of patients with having problems with stenosis of the bone jaw area, and there's not enough growth in the bone mass, we then do recommend them if they could insert bone broth. I know it's very, very difficult, but because we use bone broth from antler deer, which is from the actual horns, we don't actually take it from an animal. It's actually basically...
It's only the antlers, it's not the bones?
Only the antlers.
Okay.
So you're not actually killing an animal, and we use in the marrow that is internally in the antlers. This is the bone broth that we're actually using. It's fantastic. It's very easily absorbed. The results are phenomenal, and there's hardly any form of side effect.
Yeah.
So if you combine the bone broth with some silica, high form of vitamin DK, and obviously we look at the deficiencies of a patient and put a good protocol for them together, we have really good results. But the bone broth is actually the base of rebuilding bone structure.
It is. Yeah. And unfortunately, I have loads of vegetarian patients that are not taking care of their vitamin B status.
Yes.
That would refuse to take bone broth, and there we go.
Even antler.
Yeah, and actually, I think that's really good. Many would compromise on that.
I see that because we do measure the bone mass, and it's actually quite frightening. So, we did a study in 25 vegan patients, and I can tell you that all 25 vegan patients were going from osteopenia to osteoporosis. So they had to choose to follow that route or to actually cure the density of the bone. And that's where we brought in the antler bone broth. And by applying that with the silica and vitamin DK, high vitamin DK, magnesium, zinc, we started to see that the mass was growing again. Obviously, no sugar, no carbohydrates, hard carbohydrates, no alcohol at all.
Yeah.
No synthetic foods or preservatives in the diet, and slowly exercising would help to absorb these nutrients back into their bone area. And we had fantastic results.
Yeah, it's great. You just know what's... you need to know what to give the body and how to actually resolve it and then build it back in. And it's no use just saying, okay, my aunt, she had osteoporosis, my mother had osteoporosis, so it's normal to have osteoporosis. No, it's not.
No.
Many people use that as some sort of excuse,
I
or
believe
explanation.
if it's an inherited condition, you need to prevent it.
Yes.
So change your lifestyle.
Yeah.
Change your sleeping patterns. Start exercising. Eat correctly.
It's so easy.
Drink water, clean water, and take the nutrients that are absolutely necessary for your body, because every single patient is individual. I don't believe that everybody is the same.
No.
The detoxification process is necessary.
Yes, and the detox is different also in every patient. So
what would you recommend for detoxing?
It depends on the metal load. Basically, we do chelation therapy with EDTA.
It's really good.
You just need to fill up your zinc metabolism afterwards, because it's also...
It depletes the zinc. Yeah.
Yes, it does. And long term, I think it's the way I do it personally. For me, is I use coriander tincture and chlorella, like 60 tablets a day. Not every day, but every 2 or 3 months, I do some sort of chlorella diet. And you really you feel it when you're getting rid of it. You're coming down and you're being tired a bit. And I think these measures they're basically enough if you watch a bit, not to have too much seafood or too much sea fish.
Yes.
And to lower your intake of heavy metals. It's manageable. You just need to be aware of it and
Absolutely.
not closing your eyes to it.
So you'd look for the fish that's got the most mercury. Stay away from that. Okay, so what would you say the key nutrient that people are often lacking for the healing process?
I say it's generally antioxidants, but you can't name one certain nutrition, but generally antioxidants.
So quercetin would be a good antioxidant for you?
I haven't made any experience with that particularly. I think the easiest recommendation is, in the first place, have 10 grams of ester C per day. Period. So that a basic antioxidant like a protection is given, and then you can add glutathione, quercetin, whatever you want. What's the effects that you have seen in quercetin in giving your patient?
It's like an antihistamine effect.
Okay.
So it reduces the histamine levels. It's very good for any form of allergic reactions. And it definitely helps to detoxify the system. So it's a full-blown antioxidant.
That's great.
Speaking about the vitamin C, 10 grams, if you would say that to a patient, they'd be very scared. Could you explain if there is a toxicity in that high value?
Not really, because it's being eliminated, and moreover, the ester C.
Yes.
The ester C, it's bound, it's buffered, so it's not at all acidic in the stomach.
Correct.
So, me personally, I take 3 grams in the morning, 3 midday, and 3 in the evening.
Okay.
So, ester C is the best thing to keep this up, and also the blood levels are longer and higher. So, also for mucosal healing, it's absolutely essential. I mean, this infusion, the biological treatment protocol infusion, the perioperative infusions, we give 15 grams of vitamin C. So we just flood the body with vitamin C in order also to have the gum healing tendency, to improve the gum.
And you
healing.
do that before or after the actual procedure?
1 day before, right before, and 1 day after. Also, when we do the infusion and then we draw the blood for the PRF, we have PRF high in vitamin C.
Ah, excellent. So you produce your own stem cells.
Yes.
And everybody wants that. That is amazing.
Yes.
And obviously to note that vitamin C is a water-soluble vitamin, so it doesn't stay within the body. Whatever the body doesn't want, it will reject it into the urination, so people are safe.
Exactly.
Excellent.
Most definitely.
Very, very good. Okay. And so we said that, do you know of any dietary factors that will shift the healing process faster? What would you recommend? Which foods would you recommend?
Which foods?
And which supplement would you think is the most essential?
For bone healing, or for talking generally?
Generally, after you have a procedure, whether it's an operation or removal of a tooth or a removal of a titanium implant.
Okay. Well, I would stick to this anti-inflammatory diet. No sugars, complex carbs, no white rice included.
Okay.
No meat for 2 weeks.
Absolutely.
And fish is allowed. Eggs are allowed. You need the protein intake. And veggies high in protein, like
peas,
chickpeas, for example, lentils. There's plenty of stuff.
Okay.
And talking about supplements, I would give magnesium as a citrate or bisglycinate. Zinc, vitamin C, glutathione maybe for a few days or a week. And have I had?
Would you give vitamin A for bone healing?
Vitamin A for bone healing?
In the winter, of course.
I haven't heard about that, to be honest, within this protocol.
Okay.
Would it make a difference, from your opinion?
Absolutely.
Absolutely?
Yes.
Okay.
Big difference.
Only in the winter months?
Well, we don't usually subscribe vitamin A during the summer because it causes a pigmentation effect on the skin. And we do recommend it during the winter months.
Okay.
But if it's in a multivitamin, that's not a problem.
I see.
Yeah, so if you give a vitamin A, you would give it in high values. So
okay. And vitamin D3,
absolutely.
of course.
Absolutely.
At least 10,000 units per day.
Fantastic. Very good.
Depending on the level, but we always have it measured beforehand. And if they're between 100 and 80 nanograms per milliliter, that's all right.
It's good.
So they just keep it up.
And what would you recommend as, what would your best bet be on painkillers?
Painkillers.
Would you use something natural?
Arnica C30 to prevent swelling.
Okay.
Well, basically, if we stick to the procedure and people use, we use a cooling mask called Helotherm. I don't know if you heard of it. It's like
Yes.
water circulating and cooling, 17 degrees. They hardly have any swelling or pain. Well, if they take once like 600 or 80 milligrams of ibuprofen, that's okay. I can live with that. They can.
Yeah.
And the thing is always, pain causes stress. Stress causes sympathetic state. You see, and so our objective is to keep the patients absolutely pain-free.
Absolutely. Always.
Yeah.
Yeah, that's correct. Lovely. Okay, so I think we need patient education and empowerment. I think patients need to know more about holistic dentistry, the biological methods that you're offering. So,
How
what
can we educate?
How can we educate these patients today?
Well, I think the interest is basically growing because we have more and more people buying like organic products, using organic cosmetics, like natural cosmetics, for example. And the interest is growing, basically. And we don't need to understand every facet or energetic aspects to be into that. But I think that the basic message is to go with a healthy diet, to exercise not excessively but repeatedly, like 2 to 3 times per week, like for an hour.
Good.
Let's put it that way.
Absolutely.
Not high performance, but at least do something, and take the basic supplements. And if people do that and get a bit of awareness, what does good to them and what like sucks their energy, like toxic relationships, keeping the grief or the anger inside and not dealing with it, just storing it somewhere. I think this awareness rises. People are being more aware nowadays than they've been like 10 or 20 years ago. And I think it's that already would make a big difference.
Absolutely. Okay.
Yeah.
What do most people misunderstand about dental health?
Misunderstand on dental health in general. Probably the use of fluoride, I would say.
Absolutely.
We've been told ever since fluorides are good for you, ever since. We've been putting this into children for decades, and yeah, I think it's really a question of belief, isn't it?
What could you tell us the causes of excess fluoride in the body?
Well, the thing is, locally applied, it may do good to the enamel, but systematically it'll do damage on your pineal gland, wouldn't it?
Absolutely. And is there a time that you need fluoride for your teeth, and there is a time that you don't?
Well, the thing is, they always say, if you have an acidic attack on your teeth after meals, I say, okay, when do you have an acidic attack? If there's too much sugars there that are being metabolized by the bacteria. So with limiting the sugar intake, we can also manage that.
We can manage the acidity.
So yes, most definitely there's no need to put fluoride in any way.
Right, okay.
Simple as that.
So sugar and fluoride is a culprit. Okay. Okay, so what are your views on flossing, mouthwashes, and oil pulling?
I mean, we've have been talking a bit about the oil pulling and the use of interdental brushes. I always favor the interdental brushes because the cleaning effect is just more than just playing around with a bit of thread.
Correct.
But if you got some fibers sticking between your teeth, it's okay to use a bit of floss. So.
But it can actually irritate the gum area.
It can irritate the gum areas, and for some people, it's just no use when they haven't got this tactile abilities, or I don't know if they're really old seniors that can hardly hold their toothbrush. They wouldn't be dealing with any floss.
And would you recommend patients to use electrical toothbrushes, normal toothbrushes with bristles, or would you go for an organic, let's say wood with organic fibers?
Well, that's a good question. Me personally, I'm of the opinion you can if you know how to, if you have the skills, and if you have the motorical abilities, you can brush your teeth with a mechanic toothbrush as well as an electrical one can. I think electrical toothbrushes are like it's just gadgets from the industry that promise to be convenient to us.
Right.
I mean, there's these sonic toothbrushes that oscillate like on lower frequencies.
Okay.
And they're suitable for people with severe gum diseases in the beginning. Or alternatively, you can use these super soft brushes that wouldn't irritate your gums. But still, in those cases we need to go to the root cause to watch. Okay, what nutrients are they lacking in? Are their middle organ meridians blocked? Do we have energetic issues that show up in the gums in chronic inflammation? Because it's usually the middle organs that are
Affected.
Energetically affected.
Yeah. Okay. And how often would you change your toothbrush?
So you can basically judge it by
Just looking at it, right?
Looking at it, yeah, that's right.
And how would you sterilize your toothbrush?
So I think that proper rinsing is enough. You know,
You don't need to do anything else.
And change it often enough. I mean, if it really looks like that, I mean, even you wouldn't use a broom like that, so you wouldn't use a toothbrush looking. Yes.
And
The oil pulling is to get back to that point. As said, the right oils are far more effective than any toothpaste I've known. So there's certain compositions like this black cumin seed oil, geranium oil, also calendula oil that can help loads and loads and loads in gum diseases.
absolutely.
As it's used on a daily basis. Mm-hmm. That's how the medications used to should be used basically on a daily basis, and including being included to our nutritions.
Absolutely. Even using just simple coconut oil by gargle in the mouth 30 days, you can actually remove thrush and candida off the tongue. So you can see that the tongue from being white eventually becomes beautiful pink, and there's so much less stress. And we found that just by simply using coconut oil, you actually can help shrink the gums, in the sense of any loose gums and loose teeth, you can actually bind them by using the coconut oils. Can you imagine using the oils that you've just recommended? And cumin oil, because it's an absolute sterilizer of bacteria that is so strong in helping remove amoebas, we found.
Okay.
And amoebas love living in the mouth. So a lot of problems come from those type of parasites, and mouth pulling really helps.
That's
In
amazing.
that situation. Yeah, so it's good for people to know.
Keep it simple, yes.
Absolutely. Okay. So
Yeah, that's great.
I think we're coming to a closure.
Yes.
And just some final thoughts that you'd like to share with us.
Some final thoughts. Being preventive is always better than like treating anything, and keeping common sense up, using easy and little things that are available on a daily basis. That's like the basic recommendation to everybody.
Okay.
And being having this like awareness to stay away from energy consuming behaviors or partnerships, relationships. Yeah, right.
Absolutely. So the emotional has always got an effect on the physical.
Always, always. I mean, in traditional Chinese medicine for thousands of years, it's been an absolute integral part, right?
Absolutely.
And in Western medicine, okay, psychologists are a bit of okay. Nothing else helps. Okay, get him to the psychiatrist. You know.
Yeah, of course, absolutely.
Which is a shame. Which is a shame, basically.
And nobody would actually think that a problematic mouth would cause an emotional dysfunction.
And vice versa. And vice versa.
And vice versa, absolutely.
Yeah.
Okay, so one myth about dentistry you wish would disappear. What would that be?
That is painful.
Inflammation, absolutely.
It creates this horror picture. You're right. When you tell kids, for example, don't be afraid, it won't hurt. Okay, what's going on in this kid's mind? There's made no experience with a dentist. Okay, worry, hurt. Why do people implement this in absolutely blank minds concerning dentistry?
Okay, and where can listeners find you or learn more about you?
Well,
Work?
basically on our website is the absolute essential infos are compiled on the website. And there's also further information given to be looked up on the internet, which is the emphasizing on the works of Dr. Lechner, who has done loads of research on the cavitations and their effects on the immune system, so the white blood cells, and also the websites of the German Academy of Acupuncture, which is in German, but unfortunately, yes.
That'll be difficult for us here in Cyprus.
Yes.
Very difficult.
Yes.
Okay.
But people can always write me an email. So
absolutely.
If they have certain questions or some certain subjects to be discussed.
Great. It was absolutely wonderful having you.
It was my biggest pleasure.
Thank you for all this information. I think we have so much to learn, so much to integrate in this healing process and getting people to a much healthier form of living. And I truly want to thank you.
I thank you, Andri, and I'm really looking forward to better long-term outcomes for our jointly treated mutual patients.
You're very welcome.
Thank you very much. Yes.
Everything for our patients.
Yes.
Thank you so much.
You're welcome.